Good morning all. I'll be presenting about the efficacy of intravitreal Bevacizumab as a monotherapy for treatment of aggressive retinopathy of prematurity. Okay, so India has the highest number of preterm births, that is around 3.535 lakhs, that was measured in 2010. And if we consider up to 18,000 of these infants will go blind if not a proper screening protocol is ensured. As we know, the infant mortality rate is falling in countries like India and other developing countries, and the graph here clearly shows that once the infant mortality rate reduces, the chance of ROP or incidence of ROP rises. So ROP is a vasoprotective disease which significantly affects or causes pediatric morbidity and blindness throughout the world, whereas aggressive ROP may progress rapidly to retinal detachment if not recognized and treated early. Okay, this is just a few examples of patients with aggressive ROP where how a different spectrum of disease is explained here. Okay, so intravitreal anti-VEGF therapy has gained wider applicability in the treatment of ROP, and the efficacy is important because it helps in reduced vision loss as well as there are no side effects of the laser that are performed. So purpose of the study was that we did not have that good outcomes with laser, so we decided to start doing Bevacizumab injections as a monotherapy to treat aggressive ROP, and this is our experience over a 60-month period for the treatment of aggressive ROP. So it's a retrospective case series with the main outcome measures as ROP regression and the associated with the monotherapy of Bevacizumab. Demographic data including gestational age, birth weight and ROP severity were collected, and student t-test and regression analysis was used for this study sample. So data from 476 eyes of 248 patients were included, but eyes treated only with Bevacizumab were included. So out of this, a total of 298 eyes of 151 patients remained in the sample. The study period was from August 2017 to December 2022. We define the signs of regression as pupil dilatation, disappearance or decrease of retinal vessel tortuosity, and growth of normal retinal vessels towards the peripheral retina. And treatment failure was defined as persistence or reappearance of the plush disease and neovascularization which is progressing. For recurrence, conventional laser was used to treat the recurrence. In short, if you look at the results in brief, the ratio was 82 children were female compared to 69 which was males. 31.25 was the mean gestational age, and when the infant was presented to us, the mean age at presentation or post-menstrual age was 36. So there was a gap of 5 weeks here. The mean birth weight was 1.4 kg or 1483 grams. The mean NICU stay for this infant was 25 days, and the mean injection time, that is the post-menstrual age, was 36.03, which shows that we injected mostly on the same day or the next day when the patient presented to us. The median follow-up after Bevacizumab injection was 7, that is 1 week was the median follow-up. Again, this is important because in between COVID came in and we had extended the follow-up for certain individuals or certain babies. Mean follow-up was 10 months and the mean number of visits were 8.5. Respiratory distress syndrome was the most common systemic risk factors along with the neonatal jaundice and sepsis. The recurrence post Bevacizumab was around 16%, for which laser was used for in 21 eyes, and 4 cases had required a repeat Bevacizumab, but majorly it was a laser therapy which was performed for such eyes. Cataract was noted in 2 eyes of such out of the total cases. Rationale for anti-VEGF is concentration of VEGF is increased in the vitreous of infants with ROP. Bevacizumab not only blocks the molecule of VEGF, but also inhibits the production of new onset anti-VEGF molecule. So better and rapid outcomes compared to laser. Just one example what I showed. Post Bevacizumab you have complete vascularization of the retina with no laser scars obviously. So 31 weeks suggests extreme preterm neonates. Good screening across the state as a PM at first follow-up was 36 weeks. Mean time of injection 36 weeks. That means treated early after first visit, mostly on the same day. By 1 week, we had most of the patients, more than 50% of the patient regression was already noted. And by week 6, we had 90% of patients who had complete regression of the ROP. Low birth weight and extreme prematurity are the most important risk factors for developing an aggressive ROP. And 80% or 84% of children regressed spontaneously post bevacizumab. So it is safe and efficacious. There were no endophthalmitis. Only 2 cases of cataract were noted, and no long-term sequelae as noted as of now. Limitations are retrospective nature and lack of a concomitant control group. We had only one control group here, that is bevacizumab. So ROP regression rate after one intravitreal bevacizumab was 84%, which shows the efficacy of a monotherapy as anti-VEGF treatment is strongly recommended. Thank you so much. Thank you. Thank you for allowing me. Thank you. Thank you so much. Thank you.